Welcome, colleagues. I can see people are still joining. I would like us to give it a few more minutes for people to join, and then we shall start. Okay, 1 more minute, colleagues, and then we shall start the webinar. Okay, welcome everyone to this webinar today. As you might all have seen, our webinar is entitled "Every Child Has the Right to be Free from Fear." So it's focused on child protection. We know it's a very critical topic, particularly in our country where women and children are experiencing a lot of challenges and a lot of abuse. Just to indicate that today we have a wonderful lineup of speakers who have got a lot of experience and knowledge on this subject. We have speakers who are drawn from World Vision South Africa, World Vision Southern Africa, UNICEF, Africa Tikkun, and Save the Children. So we want to welcome you again and thank you for choosing to join in our webinar today. But before we start, we would like to do a quick poll just to see how you have experienced child protection in your work or life. I'm just going to turn on a poll and I request everyone to quickly do it. Okay, I can see we are at 88%. Okay, I'm gonna give it 1 more minute. All right. As we can see, it looks like most of the people on this call do, in one way or the other, have worked in the child protection space, around 89%, and they have some knowledge about child protection. So at this moment, I would like to quickly go to a video to start us off on our webinar. Please enjoy the video.
No girl should have to live in fear. But so many of us do. Where I live, every day holds dangers. Just because I'm a girl.
We live in fear of violence that takes many forms.
We fear walking home from school,
being forced into labor, into marriage.
We want to know our rights,
to stand up, to have choices.
We want to live free of fear.
Around the world, girls are saying enough is enough. Like Musoni and the Henna girls, who are standing up against violence and educating their village about girls' rights.
Imagine being part of 1,000 more stories, just like Musuni's.
Right now, thousands of girls urgently need a sponsor. Join the movement to sponsor 1,000 girls by International Day of the Girl, October 11th.
Together, you and I can create a future without fear. Sponsor a girl today.
You're muted, Ernest.
Okay, my apologies. My name's Ernest Fraser. I'm the Operations Director for World Vision South Africa. And I want to quickly introduce the speakers that we have today. And I will start with Moruti Pitso. Please quickly introduce yourself. Tell us your names and what you do with World Vision. Over to you, Pitso.
Thank you, Ernest, and good morning, everyone. My name is Moruti Pitso, working as Child Protection and Advocacy Manager for World Vision South Africa, based in the Johannesburg office. Thank you.
Thank you so much, Pitso. And I would like to move on to my colleague from Africa Tikkun, Mahwape Leti. Can you please introduce yourself?
Good morning. My name is Mahwape Leti. I'm from Africa Tikkun. I'm a research, development, and strategy consultant focusing on child safeguarding, organizational safeguarding, and disability advocacy. Thank you.
Thank you so much, Mahwape. At this time, I would like to request my colleague Harriet Zambika to introduce herself.
Thank you very much, Ernest. Good morning, everyone. Welcome to the call. My name is Harriet Zambika. I am the Child Protection Lead for Southern Africa region. I work for World Vision International. Thank you very much.
Thank you, Harriet. We'll move on now to our next speaker, Mike Hulpretz from UNICEF. Can you please kindly introduce yourself?
Good morning, everyone. It's my pleasure to be here with you this morning. My name is Maaike Huibrechts. I'm the head of the Child Protection Program for UNICEF in South Africa. And we are covering areas of child rights governance, child protection with many stakeholders across the country, as well as social protection. Thank you so much.
Thank you very much. Last but not least, I would like to move on to our colleague, Steve from Save the Children. Please introduce yourself, Steve.
Hi, everybody. My name is Steve Miller. I'm the CEO for Save the Children here in South Africa, but I also represent the CSO community on the executive committee of the Global Partnership to End Violence Against Children. I'm really happy to be here and look forward to the discussions. Thanks, Ernest.
Thank you so much, colleagues. Before we move on to our speakers, I would like just to encourage us. We will make the presentations and then we'll open up for questions at the end of all the presentations. So our speakers will be ready as a panel to answer any question that we may have. So as we continue with the presentations, I would encourage you to please type in your question or comment on the chat box just on your extreme right. You will see there is settings, attendees, and then there is chat. So you just click on chat and then you type in your question or your comment. Without much further ado, I would want to welcome our first speaker for the day, Moruti Pitso, who is going to make his presentation to us. Welcome back, Pitso.
Thank you. Thank you. I'm quite excited to be part of this session and looking forward to the discussions. Without wasting time, I would like to talk about World Vision, child protection, and impact. And from that, I will talk about World Vision in general, just to give you a brief background. That World Vision works in three pillars, which are humanitarian assistance and relief, advocacy, as well as community development. So my presentation is going to be zoomed straight into child protection for World Vision South Africa, as well as the impact that we have experienced. So we first of all define a child in child protection, and then talk about the priorities that we are going to focus on as World Vision South Africa. And we define child protection as all measures taken to prevent and respond to exploitation, neglect, abuse, and all forms of violence against children. And who is the child in this case? The child is anyone under the ages of 18. And we are particular about our safeguarding policy, which covers all children everywhere, not just within World Vision catchments or areas of operation. And the prioritized child wellbeing objectives for World Vision have been to ensure that children are cared for, protected, and participating. It is very key to us. And to that, we do it by increasing the number of girls and boys who are protected from violence. And this we do by our tried and tested models that are evidence and results-based. We talk of the models such as Citizen Voice and Action, abbreviated as CVA. We have Channels of Hope, abbreviated as COH. We also have the Peace Road model, which is one of the models that works well with children on a peer-to-peer basis. Again, on protection of children and participation, we ensure that parents or caregivers provide well for their children. And again, another priority area is to ensure that children are educated for life. And this we focus particularly on adolescents to make sure that they are ready, learned, and going to participate for economic development. So basically, we have the child at the core center of the whole World Vision programming. And then from the center or from the core where the child sits, we have the family as well as the community to support child in order to see that all the aspirations of the child are achieved, that they enjoy a good health, that they are educated for life, that they enjoy the love of their parents and their neighbors, as well as the love of God. So we again move peripherally further to say, now we ensure that from the center where the child is being groomed, there is public and civil society, a sector to ensure the enabling policy environment for child growth and protection. So we inspire to see no child without education, because education is key in World Vision programming as part of our child wellbeing aspirations. So we were able, as World Vision, to work with 20 schools, which we supported with ICT facilities, computers, interactive whiteboards, routers, calculators, and Wi-Fi. For this, we are trying to make it easy for children to learn, because you remember we are now entering the 4th industrial revolution, and this is where now children need to move to digital platforms. And this is daily what we are looking at as World Vision. And from that intervention, which was done in one of our area programs in the Eastern Cape, we were able to reach out to 13,500 children, and we are still looking and willing to do more. We again ensure that children are protected and enjoy good health, and from this, we were able to install 336 hand washing stations, as well as TP taps, which were popularized as one of the most cost-effective measures for enhancement of hygiene in the communities that we work in. And then we were able again to partner with the media, particularly SABC radio stations, as well as community radios, where from that combined partnership, we were able to reach about 9 million people with messages of hygiene and safe drinking water. This helps a lot because in the era of COVID, we can't afford not to be hygienic, and children are the most exposed to these diseases. So promoting hygiene at school level is basically what we are focusing on. We again focus on early childhood development, which is another fundamental area that is key to child's education. Here we were able to provide learning materials, child-friendly spaces, furniture and equipment, also material to support school nutrition programs. And from that, we were able to reach about 34 ECDs, and from those, 1,020 children were impacted or benefited, which is quite a good achievement, and there is potential to do more and the will to protect more children in our areas of operation. So in our advocacy work, which is child-led in most cases, we're able to participate in Children's Amendment Bill 2020 consultation, where children's voices were elevated to hear exactly what it is that they want to see in the amendment bill. So here we had different consultations held in the Limpopo area, where we have our area programs. We also had a good participation in our Free State offices as well, where the SABC was even there to capture children's voices, and our children were able to go on media to talk about these issues that they want to see captured or addressed in the amendment bill. We are again as World Vision privileged to be part of the case flow management committee within Department of Social Development, because we are looking at ensuring that our advocacy reaches those children who are left out during child grants and other needs and rights that they are entitled to. So birth and child registration are very key to every child, and this is one of the areas that we focus in, and we are part of the Department of Social Development, Department of Health, Department of Home Affairs, where we sit together in seeing that all this happen. So in one of our models, which is called Channels of Hope, that I talked about in passing in our previous slides, we work strongly with churches because we believe every community has churches, and churches are a reliable conduit to pass child protection messages, because in this era where child protection in the form of sexual violence as well as gender-based violence are a pandemic, which is the second pandemic in the country as far as research shows, we are directly and intentional about focusing on child protection and getting the messages through, among others, churches, because they have seemed to work phenomenally well with our communities, because all our communities believe in what they hear in churches. So this is part of the strategies that we have decided to adopt as child protection team within World Vision South Africa. And it is yielding remarkable results, because it is beginning to see changes in numbers, which is what exactly we are trying to do in the areas that we operate in. I think that is the end of my brief presentation, which is basically for child protection, because all our models are groomed in a way that we want children to benefit directly from what they learn, as well as being able to impart their knowledge to their peers in their communities, so that we have a complete behavior change that will see us going forward with reduced numbers of incidents of violence. Thank you. I think I can open the floor and I can ask the director. Thank you.
You can hand over back to me, Pitso. Thank you so much for your presentation. And I do encourage our revered participants on this webinar to please type in any questions that you may have. And then we will allow Pitso Moruti to respond to those questions at the end of all the presentations. And I really would like to acknowledge all the people who are on this call. I can see we have people from different parts of the country, and we also have colleagues who are joining in from even outside the country. So we really want to acknowledge each one of you and thank you for joining. Without much further ado, at this moment, I would like to invite Mokgwape Letsi from Africa Tikkun to the stage. Welcome, Mokgwape.
Thank you so much, Ernest, and thank you so much, everyone, for joining us. As mentioned before, my name is Mokgwape Letsi, and I work for Africa Tikkun. And just for this presentation, I'll really just be taking you through our key learnings in the past few years on a process that we started actually in 2017 before COVID. Just a brief background of Africa Tikkun. Africa Tikkun is an NGO. We are based in South Africa, in the Netherlands, and in the UK. But I will specifically be talking about what we did in South Africa. In South Africa, we work in centers of excellence in townships, and we work with children from ECD to what we call CDP, which is career development. So basically, we see children from the age of around 2 to 3 years old up until they are young adults of like 21 or 25. So it is very important for us to have a child protection policy and also have some sort of child protection procedures and process in place. We started a funder required process at the time, but we did a lot of reflection at the time. And really what we wanted to do was to make sure that Africa Tikkun is a safe, inclusive, non-discriminatory environment for children and youth and families. We also work a lot with children with disabilities and their families. So we wanted to make sure that our environment is safe and inclusive for children with disabilities. So our first objective was to update our policy. And then, like I said, we also really wanted to focus a lot on children with disabilities and their families. And then lastly, we wanted to undertake an advocacy campaign about child protection. So like I said, the first thing we did was the need to update our policy. I think I've been doing this work quite a lot, and we do find that most organizations do have policies. Unfortunately, the policies do become sort of dormant. We don't use our policies anymore. And that was the instance for Africa Tikkun. So we had to review our policy and just make sure that our policy is being used. And I think the main thing was really just to figure out, how do you make a policy relevant for a 5-year-old? Or how do you make a policy relevant for, a 10-year-old? And at the same time, how do we get our staff to take accountability and also just sign into this call of action of making sure that children are safe in our centers? We also wanted to follow a very participatory process. I'm a researcher myself. I'm a development researcher. So it was very important for me to engage with young children and find out as much as I could to say, how can we keep you safe? How do you think this organization can be safe for you? And so I engaged with about 300 children using participatory methods. They were ranging from the age of 5 up until 18. And we kind of used a lot of different methodologies in finding out and amplifying their voices. What we found out from our young people was that, one, they were not feeling safe enough to speak out. So mainly because A, they didn't know who to speak to within the organization, and B, they didn't trust that whoever they spoke to would actually take their concerns seriously. Our organization also had a lot of problems at the time with confidentiality. So even if a young person did speak out, they were not confident enough that whatever they said would be treated in confidence and that their cases would be treated with dignity. So what we also did was raise awareness, like I said, about the policies and procedures. So not only did we say, okay, we've updated our policy, okay, we know what's wrong, we've heard what the children are saying, we also had to now have a campaign where we allow people, and we called it a movement, where we were actually engaging with everyone, including parents and everyone else, to say, you know, child protection is serious in our communities and how do we keep our people safe. So that being said, I would like to play a video for you that shows you our campaign. Our campaign was called Memeza Bazokuzwa. It's Zulu and it means speak out, you will be heard. And it was in response to the fact that our young people were saying that they are not confident to speak out, number one, and number two, when they do speak out, they don't think that they are heard. So I'll just play a 3-minute video for you. Please bear with me.
The idea of this year's campaign, which is really the launch within Africa Tikkun, is to effectively not only promote the concept of child safety, child development within Tikkun, but to take it out onto the street so that parents, caregivers, associated individuals recognize that this is in fact a movement. This isn't just a voice from one organization. It's actually a movement that lives on the street.
Memeza Bazokuzwa, it's all about saying, speak out, you'll be heard, so that you can get help.
So it's a campaign that Africa Tikkun has introduced to say that if you are being abused, if something bad is happening to you at home, as a young person, you should shout, you should speak out.
The parade was very fantastic. Parade was very good. Most of the people were not aware. They didn't even know what was happening.
Everybody was supporting. I saw even taxi drivers stopping along the way. They were so excited to see people standing up for their rights.
Them walking around, singing, dancing, chanting, Memeza Bazokuzwa, it was them feeling safe in their community as well, with us adults right by them.
We say no to child abuse.
As you know, before, our parents, they used to take us to school and it was all about the teachers. Now we are trying to empower them to continue what the teachers have been doing at school, so the child will know that as they are protected at school, in our ECD, they are also protected at home.
You have a voice, and that voice is there to be used. Nobody should ever stop you from exercising that right to speak. Nothing is ever too small for you to say. Nothing is ever too big for you to say. If you feel like saying something, just know that you have a right to say the small things and the big things, the right things and the wrong things. And people out there will then be able to guide you accordingly.
If something is happening with you, you need someone to talk to. Shout for help, whether it's with your neighbor or your social workers. All these stakeholders are available in our communities. They are there for you to assist. We are paid to do our jobs. Use us. We are there for you to help you. If you keep quiet, no one's ever going to know what's happening with you.
Be you and nobody else. Know that you have unlimited potential. Know that you are capable and have an ability to do anything or to become anything that you want to become in life. Do not live your life based on other people's opinions. Do not let anybody tell you who you are. You are who you are, and in you, there's the future. In you, there's the best. In you, there's a leader. So if you feel like your rights are being violated, know that you can be an advocate to yourself. So Memeza Bazokuzwa.
Memeza Bazokuzwa.
Memeza.
Memeza bazokuzwa. Memeza bazokuzwa. Memeza bazokuzwa. Woo!
Okay. And every time I watch that, it actually just melts my heart. As you can see here, this was before COVID, so there were no masks. Life was good. I don't know when we'll be able to do this again, but that was our campaign. We engaged with everyone. We engaged with, as you saw the SAPS, we engaged with parents, we engaged with everyone, because safety for a child, if you look at the holistic development of a child, safety is not just at our centers, safety is at home, safety is within the communities, and safety is at schools. And this video is from 2018, and what we have done is that every year we have a child protection parade, we have a child protection dialogue, apart from last year was virtual, fortunately, and every year we actually try to remind children that, you know, don't just keep quiet, because that's what we found the problem was amongst our beneficiaries. So the target audience, like we said, it was our beneficiaries, our staff, our parents, the visitors that come to our centers, our community, and our board members. The board member aspect for me is very important, because most of the time we don't engage with board members or people that are higher up in our organizations when it comes to creating awareness or actually educating them on child protection or child safeguarding. So it's always important to remember that. We used everything for the campaign. We used WhatsApp, we used Facebook and Twitter. We as an organization, we're a bit of a big organization. So we also have a marketing team, and we're lucky enough to have a team that was able to assist us in that regard. And we also had just a lot of campaign elements. We had bookmarks and we had a lot of things, because when we did the research, we found that most people would say, we know there's a child protection policy, but we signed it and we just pegged it away. And the main questions was, how do we make sure that child protection is at the forefront of everyone's mind, that everything that you do, you remember, you know, there's a child, you work with a child, and your mandate is to make sure that they are protected. On your screen here is also some of the things that we had. We had bookmarks and we had stickers, and all of that really was in an effort to make sure that this particular topic, which is very sensitive, remains relevant in people's minds and in people's hearts. What we also had to do was make sure that staff are aware and understand, which is something that we always take for granted, right? If you work with children, you think that staff know what child protection is, and staff know what to do, staff know that they need to maintain confidentiality. But in our instance, we found that that was not the case. So as a result, we had, and we're still having, what we call child protection trainings, mandatory child protection training. So as soon as you enter the organization, you have to have a training. And then we also have recaps and mandatory reviews every year of that training, just to make sure that whoever enters our doors knows what Africa Tikkun says about child protection. Again, another problem that we had was that concerns or child protection or safeguarding incidents were not handled appropriately. So we had to put measures in place in that regard. The first thing that we had to do, if you see the picture here, is that we had to make sure that children know who to report their incidents to. So we had to appoint a child protection officer, what we call a child protection officer, who would be the social worker in every center, and kind of put posters all over, and also have awareness and trainings on actually making the children aware that there is a child protection officer, and that's who you tell. And then we also had a reporting flow chart for staff members to say, how do you report child protection concerns, just to make sure that we contain those concerns and they just don't go all over the place. HR, of course, plays an imperative role in child safeguarding, in organizational safeguarding, and everything else. And so we also had to engage with HR. We vetted all our staff. And we continue to vet all our staff as they come in. And we undertook a whole process where we made sure that staff understand, and staff are also held accountable. if you look on my screen here, this is how our baseline looked like in terms of child protection policy and the 4 facets of safeguarding, which are accountability, policy, people, and procedures. Our accountability measures were very bad. So we knew people would do wrong or staff members would do wrong, but they wouldn't be held accountable, mainly because we did not have a policy and procedures in place that assisted us in holding them accountable. Our people, on the people aspect as well, we didn't do so good considering we work with children. When we vetted our staff, we did find, unfortunately, that there are staff that we had in our centers that did have criminal histories, not necessarily related to children. And, they had not declared that at the beginning. So that was the main thing. And then our procedures as well, like I say, that was not the case. Fast forward to the next page, that this is last year, 2020. As you can see, we were a bit better with the accountability measures. We still had a bit of orange there, and orange is partially in place. Green is in place, and then red is not in place. Our policies, everything is in place. Our people, everything is in place, and our procedures as well, everything is in place. So we do see the difference with all the measures that we put in. And then lastly, what we have done with our young people is that from an ECD level to a CYD level, CYD is what we call child and youth development, but basically from the age of 3 to the age of 25, we make sure that there are some programs that I think Peter also spoke about it, just involving young people to be able to speak out about child protection, to educate them about child protection and so forth. And then lastly, we as an organization had a huge problem with bullying amongst our children. So we also had to do a lot of work with regards to educating them about bullying and also helping them hold each other accountable when it comes to bullying. I think this is it. Thank you so much. I had so much to say and so much to share with you, but unfortunately, time was not on our side. And yes, thank you so much, Ernest. Over to you.
Thank you so much, Mokwape. That was very enlightening. Memeza bazobuzwa. I think it's a message that needs to be driven continuously, especially in our country. Memeza bazobuzwa. Shout and you will be heard. Without much further ado, I would like to invite Harriet Zambiga to come on stage and give us a more regional perspective of the topic of the day. Over to you, Harriet. Thank you.
Thank you very much, Ernest, and thank you for the opportunity. Like I mentioned, my name is Harriet, and I work for World Vision at the regional level, looking at child protection. So basically, I think even as we are talking about child protection, the right to be free from fear, we want to understand how best we as an organization are working. As an organization, we are focused on children, and we are saying what we want to do is basically to ensure that there is a sustained well-being for children. We know that even as we are doing our programming, many times we do interact with the children, we do engage with the communities, but sometimes some of our processes may be, they may just end as the project ends, as the interventions end. But our focus is to ensure that even as we're working with children, we are living a sustained livelihood, especially for the most vulnerable. We are also very, very interested in the wholeness of the lives of the children, the lives of the community members and their families. And what we want to see is that there is dignity, there is justice, there is peace, and there is hope. And so to do this, we work with several people, we work with the communities directly. We do have partners as well as stakeholders to ensure that even as we are doing so, we can also engage the children, as my last two speakers have also highlighted, so that they can exploit their potential, they can build their livelihood, their life skills, and they can also thrive. Then we're also saying, how do we ensure we do this? We need to ensure that we are empowering the children, we are working with the partners, we are working with the communities to be able to advocate for themselves, to be empowered to speak up for themselves, to be empowered to address the root causes of poverty and child protection. The declaration from the Human Rights Commission indicates that freedom from fear is a fundamental human right. And as World Vision, as a partnership, as a region, we are very, very interested to ensure that there is freedom from fear from all from the children, and also making sure that even as we are doing so, our children are protected within their homes, within their communities, within the spaces that they are living in. As World Vision, we care. We want to ensure hope. We want to ensure that the children are comfortable in their spaces, but we know what fear can do. We know how fear can really destabilize the child's life. And that is why we have prioritized child protection as part of our mandate, knowing that it affects the child's mental health, the child's emotional health, the child's physical health, even the child's spiritual health. Relationships are destroyed, relationships are affected. A child cannot go to an adult and speak out and confide in the child. The child is just gripped with fear and unable to even express themselves, to share their ideas, to participate, to voice out their concerns about their livelihood. And this is why, as an organization, we care. So even as we are moving forward, what are some of the interventions to promote the right to be free from fear for our children? So one of the things I've mentioned by our two last speakers, which keeps coming up because it's very, very key, empowering the children with resilience, life skills, and voice. Because what we want to see is that children are now able to speak for themselves. They are participating within their communities. They are participating, making decisions, also participating in higher forums with people that are influential in parliament, and being able to just raise those issues that are affecting them. Then we're also looking at areas in which we are able now to influence the circle of the child within where the child is coming in from, the people around the child, the organizations, the institutions that are around the child, the church. How do we ensure that we transform attitudes, norms, and behaviors? Because we believe that even as we are promoting freedom from fear, we know that if we do not we don't influence the child's ecology or the child's circle, then it means that we will not be able to make any progress. So we work with several people, the traditional leaders, we work with churches, we work with parents to be able to ensure that even in that space, their norms, the traditions, the attitudes are changing towards ensuring that everybody promotes the freedom from fear. Then we're also looking at strengthening the services, the reporting and referral mechanisms within where the child is living, so that the child is also able to know that if they have an issue, if they have a problem, if there is a child protection concern, they can actually report and they know where they're reporting this. Then we also have, of course, laws and policies, as well as ensuring accountability. And so as World Vision, we do have a model, as Peter mentioned, to ensure that even the lawmakers and other service providers are held accountable for what they're supposed to deliver. And so we want to empower the communities. We want to empower the children to be able to speak out, advocate, to ensure that there is accountability. And to do this, we also want to ensure sustainability so that even as our projects are phasing out, are leaving the community, we are moving to another area, the community is left with that particular asset, with that particular skill to be able to negotiate, to talk, to engage leaders and other stakeholders, to change policies and to influence. So when we talk about the 4 aspects that I've just highlighted, as we speak about empowering children, as an organization, we have had a campaign that we have been running, which is It Takes a World to End Violence Against Children. And even in this campaign, we want and we have promoted the children to lead the mobilization, the children to actually change, because we believe that they are agents of change. So to change the course in which we are in, to ensure that they influence, to ensure that they're actually participating. And then when we look at the tradition, the transformation of attitudes, norms, and behaviors, we work with traditional leaders, we work with faith leaders, and the parents. And so we are saying, can we ensure that we have positive parenting? Because once we get into the space of the child, where the child is coming from, the home of the child, you find that if the child is fearing or has fear from that particular space or from the beginning, then it becomes a real big issue. So if the child is abused, the environment is toxic, it is not a comfortable environment, they are not free, they cannot speak out, they cannot share their ideas, then it becomes tragic. So this is where we are saying, let the guardians, the parents, and the people that are taking care of the child actually have positive ways in which they can parent the children. Then talking about the services and reporting mechanisms to ensure that they are strengthened, to ensure that they are working, they are functional, and they are accessible. We as an organization do mobilize and work with what we call CPA groups, that is child protection and advocacy groups, which are based in each of the communities that we're working in, and ensuring that their community is actually participating in ensuring that they protect the community, they protect the children in the community, and ensure that this service is actually working. So with the referral and reporting mechanism, other than the other stakeholders or other organizations within those communities, we also ensure that this is community-led to ensure sustainability. When we talk about the laws and accountability, CVA, again, as mentioned, Citizen Voice and Action is the model that we are using. This basically empowers the community to be able to speak out, to be able to advocate, to be able to ensure that even as they are looking at certain services that are not working, not functional, not operational for child protection in their communities, they are then able to influence the key stakeholders that actually make the laws, actually make the policies, and actually make the decisions to ensure that there is progress, there is a functional service, and there is availability and accessibility to that service that protects the child and helps the child to actually be free from fear. So when we look at building resilience, and as mentioned, empowering children and adolescents is one of our key priorities. And because as World Vision, we are child focused, and we believe that when we work with the child, then we will have a better future, we will have better leaders. So what we are saying right now is that even as we are targeting our children, we do target the most vulnerable and the most vulnerable households with our interventions, ensuring that even as we are working with the families and the children, we address intergenerational patterns of social culture and gender norms through life skills activities. This way, we are then also ensuring that we are building within the child certain skills that are an advantage to them even as they are growing. Skills such as assertiveness, confidence, self-esteem. We know that these are some of the issues that we are facing within the communities that we are living in, that the children, yeah, they could be shy, they could be also feeling very, uncared for. They are also not given a space. And so we do want to advocate that even as the children are participating, they are participating formally in groups, they are representing their own children, their fellow children. They are also having their capacity built to ensure that even as they are participating, they are also leading the interventions. Then we are also insisting and very, very keen on the children being advocates and ensuring that at that local level, they're able then to ensure that they're advocating for services that are affecting them and ensuring that they are able as well to influence the adults, to influence the partners, to influence the church, to be able to make decisions that are child-friendly and have the child's interest at heart, to ensure that we promoting the freedom from fear. So we also equip the children's groups as well to ensure that even as they are engaging, they're able to know as well in terms of what they want to pursue even as they are moving on in life. Many times when we look at our communities, we find that children are not ambitious, they are shy, they don't have hope, they don't see a future. But even as we are working as an organization, we do insist on the fact that we want to bring this attitude and this behavior to a halt, whereby we are actually ensuring that the children, are able to say, when I grow up, when I move on, when I become an adult, I want to be this and this. So we're giving them hope, we're giving them ambition, and we're giving them a voice that they should not fear to be anything that they want to be in life. So we're basically empowering children with resilience, life skills, and voice. And then we're also looking at attitudes, norms, and behaviors. And even as we are transforming these attitudes within engagement with pastors, faith leaders, and just ensuring that the leaders are also able to have different perspectives around children and the protection of children. Because we know that pastors, leaders of the church are very, very influential, especially in the communities that we are working in. Then we're also looking at collaborating. Once we have done our transformative workshops, we want to see how best we collaborate. We have what we're calling the chats, which is the congregational hope action teams. And so these teams are formed within the communities, and we find that the faith leaders are now leading the process, working with the community, working with the children to ensure a protective environment within the community. Then they can be able to make their contribution and ensure that there is an increase in the protection of girls, boys, especially the most vulnerable. And of course, there is a follow-up on a biannual basis to ensure that whatever action plans that were made during the engagement are actually being done or being fulfilled, or if there are any challenges, then they are supported and strengthened. Then when we're looking at our strengthening of services and support systems, again, we are talking about being able to mobilize the groups, the child protection groups, and within the community, being able to reflect on the root causes from an analysis that we're calling ADAPT. So we are able to do an analysis within the program area, within the community that we're working in, so that we, together with the partners, know exactly what the root causes are, and then we can be able to tackle those root causes for sustainability. So we are prioritizing interventions from working with the children, interventions from working with faith leaders, interventions from influencing governments, influencing policymakers, influencing decision makers through the Citizens' Voice and Action model. Then we're also saying we are able now to ensure that we empower our teams, the people that we're working with, the children, the partners, with skills to be able to plan, to be able to have an action plan, to be able to make progress even when it comes to child protection. These teams are also able to ensure that they report any cases. They're also able to ensure that they build capacity of the community. They're able to raise awareness in terms of child protection. And then we can also move ahead with the action and evaluation within the area we are working in. Lastly, as mentioned, accountability is very, very key for us because we believe that even as we are working, we should be working together. We should be working as partners, and everyone has a contribution to make in ensuring that the children actually have freedom from fear. And so in terms of our citizen voice and action, we ensure that we engage, citizens engage. Then we also ensure that there's engagement via community gathering. Then we look at the improving of services and influencing policy. So that's the cycle that we follow. And this particular model is key because it also looks at how best can the community, at whichever level they're at, be able to analyze how effective, how efficient the services that are being provided are, and what can be done in terms of bridging those gaps. Lastly, looking at our claims and looking at what we have done as an organization, like last year, we had 500,000 people in our communities who learned how to access child protection services and information. We're also saying every day, 180 children take action to help end violence against children. We are saying every day, 200 children complete a life skills training course, and the skills they gain help to protect and advocate for themselves and others. We're also saying every day, 250 parents learn how to discipline their children without physical violence, so more children are protected from domestic abuse. Every day, our advocacy work with governments provides additional legal protection for 347,000 children across our communities. Our global campaign, like mentioned, It Takes a World to End Violence Against Children, has contributed to 700 policy changes addressing violence against children in 70 countries, enabling rights and protections for 200 million children. And even as we are working, we believe that we can do all we can with all we have so that no child is left behind. Thank you very much. I'll hand over back to Ernest.
Thank you so much, Harriet, for such a wonderful presentation. Definitely, no child should be left behind. I would like at this moment to keep encouraging those comments on the chat box and the questions on the chat box. And I would like now to welcome Maike Huberts from UNICEF to please share her presentation. Welcome.
Thank you very much, Ernest, and thank you very much, Harriet. I think the calling of my presentation this morning is really for this kind of work that Harriet just presented to go to scale. And why is that? As Mama Grata indicated last night at the birthday of our Archbishop Desmond Tutu, is that the situation of children in South Africa is on the siege. And what does it mean with that is that they are really suffering from high levels of violence and abuse and neglect. And we have to look at the urgency of action, changing the mindsets, the values, as well as ensure correctional measures and access to justice, but also do away with patriarchy. I will show you now the situation of children around the world and in South Africa and some of the recommendations UNICEF wants to make at this important conference this morning. So what have we observed since COVID is at this moment in time, 365 million children are living in extreme poverty and struggle with less than $1.90 per day. And therewith, children are more likely affected than adults to be in extreme poverty, with 17.5% of children in the age group from 0 to 17 living in extreme poverty, and 1 out of 6 children are that in the entire world, with more than half of the global population in extreme poverty that are children. We also see that the youngest children are the poorest, and nearly 20% of children under 5 are extremely poor, compared to 7.9% of adults. And the poverty levels are extremely concentrated in sub-Saharan Africa, where 2 out of 3 extreme poor children in the world now live. And the absolute number of children living in extreme poor households fell in all regions, where it increased from 2013 to 2017. So here you can see that households with more children are the ones most affected, which is not new, but we did want to share these stats with you, and also that in households with more children, the total income decreased. And in those households, there is also more likelihood to be hunger. In households with more children, the educational outcomes are most affected. We saw that as a result of the school closures, educational gains have been lost, especially for poor children who didn't have access to TV, radio, and digital devices to continue their learning journey. So this is a very complex slide. I leave it to everyone to interpret, but what we want to learn is what are the hidden impacts of a pandemic. So we saw, an infringement on human rights with being told what to do, but also, caregivers losing their livelihoods, resulting in more unemployment, and the entire level of stress and mental health of children and youth intensified as a result of school closures, less interaction with peers, inability to socialize freely outside and with others, as well as a lack of hope for the future, with a youth unemployment rate now at 63% in South Africa. So what is the situation of children in South Africa? We have an overall population of 60.14 million persons in the country, with the youth population already risen to over 21 million children. The state has done very well in ensuring the progressive realization of children's rights across the life cycle, with birth registration, immunization, ECD, and universal enrollment in primary and secondary school. However, we still see that the well-being and protection of children is lagging behind, and that 35% of children live with biological parents. We see that 94,000 children lost a caregiver as a result of COVID, and that 19% of children live with neither parent. The majority of the head of households that are caring for children are women, and the brunt of adult unemployment is affecting these women. So despite the state investments in the socio-economic realization of rights of children, 2/3 of children still live below the poverty line, with inequalities across race, gender, location, geographical location, and disability, and 1 out of 3 children experiencing a form of violence and abuse before the age of 18. This has become compounded with additional risks and social ills, such as gangsterism, youth unemployment, high levels of GBV, but also inconsistent family care. So some of the statistics that are coming out as a result of the impact of lockdown and mitigation measures for the pandemic is that intimate partner violence went up in households, directly affecting children either as they witnessed intimate partner violence amongst caregivers and adults in the household, or experienced the spillover of that violence directly in terms of child abuse. Child hunger intensified, also multidimensional poverty. And we see, since a recent U Report poll, that 65% of young people report mental health problems, and actually out of anxiety, depression, and fear for the future, poverty, and lack of jobs. So this, Steve, I stole this slide from Save the Children from a study in 2015, where you can really see that the moment children are affected by a form of violence, abuse, neglect, or exploitation, that the caregiver drops out of work, there is need for an entire system to be mobilized, the child drops out of school, and this comes at an enormous cost to society, which was estimated to be at 5.93% of GDP in 2015 alone. Hence, it's much more important to prevent violence from happening against children, and to make sure that we accelerate investments in early intervention services as to prevent violence and abuse against children. So how do we then create this nurturing care framework? I believe that the previous presenters have very well articulated the need of collaboration. No one can do this alone, as the challenges are quite substantial. We do need to reduce the proportion of children at risk of poor development and invest in children as the cornerstone of sustainable development, and make sure that every child receives the nurturing care he or she deserves. So we have seen the NGOs presenting this morning, but it's important to widen the net with the presidency, South African Human Rights Commission, collaboration with Parliament, all line departments, as well as the judiciary, the private sector, children, youth themselves, as you are so ably doing. Then the work with religious and traditional leaders is incredibly important, as they really can influence and talk about negative practices and social behaviors and address harmful social norms that still exist in society, so that all children are safe, cared for, nurtured, and they have the right to play, learn, and develop to their full potential, and can be informed and participate in decisions pertaining to them, with the most important thing, the nurturing care at the household level. So to enhance the child well-being and overall development of children, there is need for responsive caregiving at the household level, hence the importance of the parenting programs, the household visits, the men care programs, the family strengthening overall, with enhanced access to basic services for all children in an equal manner, whereby children should be safeguarded at all times with access to health, a proper diet, information, and of course education in order to become empowered and thrive to their fullest potential across their life cycle. So I am so pleased to hear this morning the work that's being done at all levels, at the family level to create that nurturing environment, at the community level with religious and traditional leaders, community dialogues, community groups, at the district level with the various line departments to enhance quality of services to children. That the integration and interoperability amongst these services are important as children's rights are interdependent. Also that corporate is going to play a major role as to enhance the pathway to the future for young people, and the media is stimulating the dialogue around this child rights governance so that all of us has a role to play to reduce the risks that children face in terms of poor development. So it will be important to look at this model. Here you have the child in a family. It's important to assess the well-being of this child and verify if this child is accessing all the services, but also refer the child to specialized programs when he or she is affected by a disability or suffering from substance abuse or any other youth development programs that are important for children to become empowered through household visits, through family strengthening programs, compounded by access to safe spaces after school. That is the time that young people are most at risk, when the caregivers are not at home and the hanging starts, where, you know, the risk can come in of drugs, early sex, sexual debuts, teenage pregnancies, gangsterism, etc., etc. So I already mentioned the importance of the monitoring of children's well-being. There is a real-time monitoring tracking tool that has recently been initiated by DSD with various partners to check the well-being of children real-time, especially the ones that are on the ground, who are by nature the poorest and most marginalized, as to create a care and referral plan and ensure that children survive, growth and develop to their full potential, but also that if issues of psychosocial needs, mental health, abuse, violence need to be addressed, that they are being addressed in an urgent manner, and that there is swift access to an integrated case management system. As no one can do it alone, there will be a great need to complement the state budget to work with the NGOs in the sphere of prevention and early intervention services, the household visits, the family strengthening, the parenting men care programs, compounded by the safe spaces. The corporate can come in with their core social, corporate social investment, as well as with their core social responsibility, and do talks in safe parks and match young people with job shadowing, mentorship, and skill building, vocational skill building opportunities. What we have seen so far through investing in programs like community-based prevention, early intervention services, is that these lead to improved retention in education and improved attendance rates, lowered rates of teenage pregnancy, increased adherence of children who are in need of chronic medication, decreased use of substance abuse, increased take-up and retention on social grants, and reduced rates of corporal punishment in the homes, and identification of abuse in a much earlier way. So our recommendations this morning is that we really look at child protection through the socio-ecological model around that child in a family, by creating a nurturing care framework for all children at all levels through collaboration and capacity building of all responsible duty bearers as to really strengthen your overall child rights governance systems. And that we really look at transformational change at high scale from children to families, communities with religious and traditional leaders, with emphasis on the workforce to be capacitated and being able to swiftly identify and refer children at risk through an integrated case management system where no child is left behind, especially children that are most vulnerable, children with disabilities, children on the move, children at risk of abuse and exploitation, that there is one simplified information management system to minimize the workload of all social service professionals working from government as well as civil society, and that effective innovative solutions are being brought into this in order to simplify the data management and referral systems. We advocate for this social compact with the state, the corporate world, as well as civil society, to accelerate investments in prevention and early intervention services so that we reach all children that are in need of special care and attention, and to be living in a nurturing care framework. And then to support the implementation of the National Strategic Plan on DBV with a focus on violence against children, building on the district development model where integrated services can be better planned for. I thank you very much. It was my great honor to be this morning here with you, and I hope that some of these slides can stay. Thank you very much.
Thank you so much, Mike, for the insightful presentation. And at this moment, we are moving to our last presentation for the day from our colleague, Steve Miller, who is the CEO of Save the Children. Welcome, Steve.
Thank you, Ernest. All right, thanks everybody. This has been a lot of really rich content from our colleagues here on the panel, and sharing your innovations and your adaptations and making those points, Mike, which I fully stand behind, that this is a collective effort. It's going to take more than CSOs and communities on the ground. We need a systemic change here for children. So I'd like to get towards a discussion, because I'm seeing some amazing questions in the chat, and I think this is all about engagement. So I'm going to focus on high-level changes to our ways of working at my organization, Save the Children, through this pandemic of COVID-19, and what that means for us, not just now, but how it's changing things for us going forward in how we work and protect children. But before I get into my piece, I'd like to play you a very short video to remind you why we do this in the first place. So if you'll allow me, I'll quickly show this video.
I'm reading this letter from my future self.
I'm gonna read a letter to my future self.
I'm future, I mean.
I'm going to read a letter to my future self.
When I grow up, I want to have a cell phone brand. It will have a sensor for blind and deaf people to use.
I will be designing clothes because at home I like doing fashion.
Businesswoman at Temba because
The reason I want to be a doctor is to save people's lives.
I want to open up a shelter for kids growing up without parents.
The reason I want to be a scientist, I want to create a cure for HIV and cancer.
Sometimes I wear my mom's clothes and shoes and I take photos. Dear future self, anything is possible.
Dear future self, anything is possible.
Dear future self, anything is possible.
Marvelous. Anything is possible. Anything is possible. We have a duty to protect the future of these children at home and in schools and communities. Why do we do that? We do that because all children have a right to a good education, healthcare, and to be free from violence, amongst many other rights. This is not something we do to feel good about. they have an absolute right to these things. We do it because there's an intergenerational cycle of violence. The number one predictor of an episode of violence is a previous episode of violence, meaning that if you are abused as a child, your chances of continuing that cycle as an adult, either as a perpetrator or as a survivor, are greatly heightened. And we do it because we are all implicated. As South Africans, we live in our bubbles, we live separately from one another. We are all implicated in the situation that we see in South Africa today, and we all have a stake in a better future for South Africa. A few days ago, I was sitting in the Violence Prevention Forum. For those of you who know it, it's a sort of loose collaboration of organizations, governments, NGOs, private sector, working to change things for children, to end violence against children. And we sat for 2 days and we discussed the definition of violence prevention. Can you believe that? The Violence Prevention Forum discussing for 2 days, and that wasn't even long enough. You'll hear more about this initiative very soon, but just to make the point that what we dwelled on was this collective responsibility. The fact that this is a systemic issue that requires a systemic approach to defeat it. We talked about healing woundedness, our history of violence in a country like South Africa and how we've not dealt with that and what that means for our children today. We talked about building an ethic of care and respect. It was a rejuvenating process because all of us involved worked extensively in the child protection space, and we put our minds together and we really tried to figure out what it's going to take for us to change things here. How do we move away from that response mindset when it comes to child protection and move into a space of prevention and early intervention? Just quickly before I talk about these big changes to the ways of working at Save the Children and others, Mike also mentioned, and some others, about COVID-19. I think obviously this is a reality that we are all very familiar with, and I'm not going to dwell on it, but enough to say that when this pandemic started last year and when we went into lockdown, we had a very different situation on our hands. And it's easy to forget that already, but we had reduced opportunities to report for children. NGOs had restricted movement we couldn't access. Children themselves had limited access to services. Government priorities changed, and perhaps for good reason, to focus on the healthcare situation. And in the home, you had this fear and anxiety that was caused by an uncertainty about our future, high levels of unemployment, toxic stress, the mental health crisis starting to take shape. And that resulted inevitably in rights violations against children. And even there, the data in the beginning was missing. We understood as practitioners in this space that something very bad was happening, but we had no sight of it. The normal places where children would report and we would get our information from were just not there anymore. So what did we do? CSOs were finding new ways from March last year of ensuring reliable, continued delivery of quality and essential protection for children. And we learned, what we learned during that period will most likely continue into the future. I know in my organization, and I'll speak a little bit about that now, our way of working with children has changed fundamentally and for the better. So what did we learn? I'm going to look at 4 areas. One is the importance of real-time information and flexibility. So throughout this pandemic, and now we take this forward as well, you keep your finger on the pulse, you understand, you speak to children, you speak to community leaders, you speak to everybody involved so you understand what's happening and you adapt your programs accordingly. Secondly, this has been the center of our focus, child participation, and Harriet spoke about it really well earlier on, but children as agents of change. Beyond your tokenistic representation of children, how do you get children to influence the strategy and policy of NGOs and others working in this space, as well as government? How do you get children to be involved in the co-design of programming, not just being the face of a program or being involved in a program, but actually helping to establish that program, to determine the direction from the very beginning? And how do you help them really become the voice that they have, giving them that platform to bring their own ideas and solutions to duty bearers? Thirdly, the importance of local knowledge. For an organization like Save the Children, we became so closely connected to local civil society organizations, to cultural mediators and others who were close to the source. And finally, and this is a really positive development, and I'll give you some links for those of you who don't have them already, sharing of resources. The partnerships that happened during this pandemic that I think are going to hold beyond this pandemic, the communities of practice, the sharing of all these wonderful innovations and adaptations in the child protection space has just been incredible. I'm going to share with you some fantastic references for this, so you can look it up afterwards if you don't know them already. Firstly, on the real-time information. So at Save the Children, from the very beginning, we started with rapid assessments. We needed to understand what was going on at the moment. And at the time when we were under level 5 and level 4, and even in periods in between, we had very little access. And so we relied on telephonic assessments, but we did gather this information, and this really helped to change how we approached our emergency response. When we launched this emergency response program, we wanted it to be around what the needs were at the time, and these needs were new for us. At the same time, donor communications with us as a civil society partner were greatly enhanced through this, and I think this is going to hold beyond as well. For the first time, perhaps ever, certainly in my lifetime, in your lifetime, we had an issue that was global. So whether your donor was in Sweden or Italy or India, wherever they were, everybody was experiencing the same thing. So there was this real connection. And I think it sped a lot of these decisions up to the benefit of children at the end of the day. Secondly, children as agents of change and raising children's voices. We really need to make space for children. They have the agency, they have the voice, and we as organizations, we realize at least that we need to get out of the way and just provide that space for children to do this. As we speak, and many of you are probably aware of this and maybe attending parts of it, we have the Nelson Mandela Children's Parliament happening at the moment, which is a good example of this. But as an organization, as Save the Children here in South Africa, we've started a process to get children directly involved in our governance. So this is an interaction with our board and figuring out how to get children involved in the strategic decisions of Save the Children. We've also started providing these spaces for children to interact directly with duty bearers. So we ran a webinar a few months ago, and maybe some of you attended that as well, in which children hosted this webinar. We invited duty bearers from national and provincial level in the government to address them and interact with children directly. And that was a fantastic example of children really taking the stage there and driving their own agenda, and Save the Children just simply supporting that process. We've also seen a real increase in child-led networking, so using social media, WhatsApp, etc., linking people closely together. So we're able to get messages out a lot quicker than we used to, and we're able to get messages in as well. And again, this will really help with our child protection programming, and it's something that I think is here to stay. Local knowledge, all of you who work in this space will know this as well. Save the Children is an international organization. I'm the CEO here of the South African branch or member of that, but we do come from a very different direction. And we've been working for a long time with local CSOs, but we now understand that we have to do this very differently. We need to really understand who we're working with. We need to provide capacity, support. We need to have genuine partnerships whereby we're not just working as an implementing partner, working through local CSOs, but connecting them to donors and other stakeholders in the environment for their own sustainability. So this is quite a step change for a lot of us in this sector. And I think it's one of the bright spots that comes out of this global pandemic, is that we understand our limitations as an organization. So we need to move into a different space and move away from direct implementation, but rather working within a CSO model that supports local CSOs, that convenes coalitions, brings people together, tries to really shift the needle for children on a national level. And our new strategy, which we brought out in the middle of the pandemic, and you can see it on our website, speaks to exactly this. And then finally is the communication, the communities of practice and the sharing of resources. And I'm just going to share with you one slide so that you can take this down, but I believe that it will also be shared with you after this. And this will be my final piece. But as mentioned earlier, I have interactions with the Global Partnership to End Violence Against Children and also working for an international organization, but based here in South Africa. What we've seen during the pandemic is this real linking up of organizations from all different sectors working to end violence against children. And it's been remarkable. We have to see this as a remarkable development in our space, in the child protection space. So these are just 3 examples of where you can find really good resources, highlighting innovations in child protection programming that are updated live. So they constantly being adapted because our environment is so uncertain, and they're free for everybody to access, and they're also there for you to provide some solutions. So the first one, the knowledge platform on the End Violence website, you can take that website down or you can just Google End Violence. The knowledge platform is a collaboration of over 450 partners around the world. So yes, not everything is going to work for you in your space, but surely amongst all of that, you're going to find something that's inspirational, that can be adapted for the type of work that you're doing in the field. The second one is the Inspiring Ways to End Violence podcast, which is linked to the same movement, but it's a wonderful sort of way to dip into some of these new innovations and adaptations. I listen to it all the time. It's updated regularly. For those of you who are not familiar with podcasts, you can download an app. Any podcast app will do. You don't pay for any of this. It's completely free. And then you search for this title, The Inspiring Ways to End Violence. You can also just get it on your web browser as well and listen to it. And you can do that while you're traveling to work, whatever it might be. And they're really entertaining, informative, well-produced podcasts that will open your mind to a lot of what's happening around the world. And again, they can be adapted here in South Africa for the benefit of our children. And then finally, my own organization, Save the Children International, we have a similar sort of knowledge platform. It's called Catalog, Adapt, Imagine, Innovate, and it's open to everybody. And these are lessons that we're learning around the world, including here in South Africa. We do our child protection programming across most of the country, and it's focused on positive parenting. And a lot of our learnings are also included here. It's very accessible. There's lots of videos, short reports, a real evidence base for what works and what doesn't. And again, it's live, it's evolving all the time. So I'll end there and hand back to Ernest, but my final word is that these that I've looked at here, I think, for all the devastation that this pandemic has caused, for all the damage it's done here in South Africa and around the world, the people who have lost their lives, the children who have lost parents, the education that's been lost, the learning that's been lost, for all of that terror that we've been living through, we need to look for these things that are coming out, that are positive, that are going to take us forward. And I think these learnings from 2020 and 2021 that you and I are living through today, all of us will remember this for the rest of our lives. The learnings that we are getting now, we're going to change the way that we work to protect children for years to come. So please explore these resources, and I look forward to the discussion. Ernest, back to you.
Thank you very much, Steve. Such a wonderful presentation, and really demonstrating in practice the common thread that has been mentioned throughout all the presentations. That the beautiful thing about organizations is the willingness to join hands, to partner, and to share resources. And these resources that you've just shared, it's a wonderful example of what all the presenters have mentioned. We are all in this together. It's our responsibility, all of us, to really join hands and do what we can to really reverse this cycle of abuse against our children. So at this point, I would like to invite all the presenters on stage, and we are going to move on into a question and answer time. There are several questions that have been raised on the chat box, and please continue to feel free to type in a question. We will take note of it and do our best to respond to it. The first question that has been posed, which I would like to give to Mike, and it says South Africa is considered as a progressive democratic country with great policies. Besides the work of NGOs, is government at all levels doing enough to ensure an enabling environment for children? It's a perception-based question. So Mike, if you can reflect on that question, and then I will still invite you back, Steve, for any additions.
Thank you very much for this question, Ernest. As I showed in my slides, that since 1994, since the onset of democracy, a lot of important work has been done to enhance the socio-economic realization of rights of children across the life cycle. But as we can see with the existing statistics pertaining to child poverty, child hunger, malnutrition, teenage pregnancy, violence and abuse against children, and very high levels of youth unemployment, that the state is not doing enough, neither are families themselves. So it is very important to understand where intensified investments are needed. One is that the level of the child support grant is not sufficient to meet the dietary needs of children. The cost of food has intensified, and the level of the grant has to be adjusted accordingly for children to have a diversified diet and meet their nutritional needs as to grow well in a resilient citizen. Secondly, ECD is only at 1/3, so there is a big journey to go. We all know the return of investment of investing in children's early lives with and cognitive development, play, recreation, socialization, and equal upbringing of both boys and girls from early age. Then lastly, it is really the path from birth to youth, empowerment and employment. And from secondary school onwards, the age from 15 to 24 is extremely critical. And there we see intensified levels of teenage pregnancy, gangsterism, substance abuse, gun violence, bullying, harassment at schools, school dropout. We have 750,000 learners who didn't go back to school after lockdown. So there are major challenges to make sure that children are empowered with a variety of skills, opportunities to tertiary learning and vocational skill building technical colleges, but then indeed this employment phase. We only have this generation and we have to make sure we invest in it as to reduce the anxiety that youth experience with not seeing this hope for the future and as a result having these mental health challenges. So we are not doing enough as a collective, and children need to be put first with urgency as they are under search, as Mama Grassa said last night, and we are about to lose the next generation of children. So it is a very urgent situation that we analyze how we work better together to ensure that all children's rights are met throughout their life cycle, that we fill the gaps and really look at the empowerment of families themselves, the communities, the schools, and then the tertiary space with the state and the corporate to really close the net and create a very safe nurturing care framework for all children at all times. Thank you.
Thank you so much. Steve, any addition?
Yeah, no, Mike has pretty much covered it, but just to say, it's worth emphasizing the point that this is a collective effort. We are all implicated in this. We all do have a role. Every single individual, every one of you listening to me, everybody that I'm going to see today on the street, whether I speak to them, whoever they are, everybody has a role to report, to get involved, to make sure that we protect our children, to be better parents. However, the government, obviously, as a duty bearer, also has a major responsibility. We have this amazing framework. We've got one of the most progressive constitutions in the world. We've got a very solid legal framework. Our gap is between that and actual implementation on the ground. And so, you know, there's a role for us in civil society. I can only speak for our sector, but there is a role for everybody else as well. But there's a role for us to really support the government in that, and also to hold them to account. And I think, you know, through this pandemic, it's a first for everybody. But the government, yes, there were some areas where, particularly with the school feeding issue last year, that all of you will remember, the lack of support to early childhood development practitioners and at that level. And I really do not see children yet at the heart of the Build Back. You know, we've been pushing for a long time ourselves and many others in this space for the Office on the Rights of the Child to be placed in the presidency and to be given correct budget and strong responsibility and to mainstream all of these issues through the presidency. And that's a really slow process. And I think at this point in time, a lot more could be done to really center children. Thanks, Dennis.
Thank you so much, Steve. I'd like to go to Mokgwepe now. There is a question that has been raised on cyberbullying. It's becoming a very, very critical issue with communities becoming network, children accessing the internet more easily nowadays. What type of programs need to be put in place to deal with the issue of cyberbullying, particularly on girls?
Thank you so much, Ernest. I think that the main thing with cyberbullying that we noticed was that people, especially in the communities that we work with, have to recognize cyberbullying as a form of bullying, of which initially we found that actually, especially parents didn't recognize it as a form of bullying, you know, because it's over the phone or it's over the internet, it's not interpersonal. So we had to, you know, there's a need to educate people on the forms of bullying and the impact of those forms of bullying to begin with, and not assume that people do know that this is a form of bullying, including children themselves, you know. Things like jokes over the phone, some children actually really that's a bullying, and parents as well. So there was a lot of need to educate parents, to educate school teachers, to educate principals on everything that is happening. And then secondly, also just to teach our young people on, you know, etiquette when it comes to things to avoid when using a cell phone or the internet. Also educate parents on what to look out for at home, to say, this is how you recognize the forms of cyberbullying and so forth. So that really is how we did it. And I know one thing for sure that we found is that a lot of cyberbullying also happens at schools, or it stems from the school into the home. So I think everybody has been talking about collaboration. And for local NGOs, it's very important for us to also collaborate with schools, so that schools are also aware that there is such a problem. And that for us has been a breakthrough, that we collaborate with schools to say, this is what's happening. And then we work together with the school, the principal, to ensure that the children are educated and they feel free to report when there is cyberbullying.
Thank you so much. Thank you so much, Mokgwepe. And just the last question that I will pose to Moruti Pitso. In terms of working in the rural areas and urban settings, what are your reflections in terms of the different challenges that are experienced in those two dynamics? Any reflection in Peter?
Yes, thank you for that. Yeah, since our focus is mostly in the rural areas, a lot of experience has been that there's lack of information and education in those areas. And what we need to strengthen is to keep using all the community-based structures and platforms to keep imparting knowledge, using our existing community structures in the form of youth clubs. We have community-based organizations to keep communicating and teaching our people their rights, because they don't understand the difference between their rights and what is an ordinary acquisition of. Because, for instance, look, they don't understand that a mere birth registration is a right and it's an entitlement. They don't understand such things. So we really need to make them aware, teach them about the significance of birth registration in order for a child to acquire their grants and to enjoy good life. So a lot is lacking on information and education. I think that is a very huge gap. And we have structures that we can penetrate the communities. We just need to up our game a little bit and penetrate them. In terms of in the urban settings, the urban settings experience a lot of rural-urban migration, because now poverty in the rural areas is now become a push factor. So when they come to towns, they also don't know that they have rights to the services that are offered in the urban centers. For instance, interprovincial movement, people don't know that they have the right to go to health facilities for free. For instance, teaching them about such things can help lower morbidity cases that result in mortality at some stages. So there is link of rural area communication as well as urban area communication in terms of the most vulnerable people, because they are all found in those two areas. We have the refugees who are internationally moving from their countries to South Africa, and then we have the local who are interprovincial migrants. So all these people, you find that they are vulnerable because they don't know the rights to certain services that can enhance their livelihoods and change the status quo for the children.
Thank you so much, Pito. I would like now the last question that I will give over to Harriet to respond. Almost all the presentations, they touched on the importance of the family. I would like you to reflect more in terms of what programs need to be put in place to ensure that the family is the foundational place for protecting children against all forms of fear.
Thank you. Thank you very much for that question. I think firstly, we need to understand what exactly the family is going through. So in terms of our communities, like we say, a child is raised by the village. And everybody in the community needs to play a role, starting from the family. So when we look at the family, we need to understand what are the issues at the family level, first of all, and what is it that we can do with the family to be able to assist, because there are a lot of things that affect the family that actually get down to the child, and that is where we begin to see the effects of the family situation impacting the child. So first of all, when it comes to the economic situation, we need to find out, first of all, how is the economic situation with the family, and is there an issue of income? Is there an issue of hunger? What is the issue exactly, and how is it impacting the child? Then when we look at the spiritual level as well, for us as an organization, being a Christian organization, or at least we do focus on spirituality, we know that there are a lot of issues that stem from the spiritual well-being of the child. And once that family has no impact in terms of their spirituality, that can also affect the child. Then when it comes to, as Steve had mentioned, intergenerational type of abuses can affect the next generation. And so when we look at that family, we need to also understand their background. Where are they coming in from? What happened before? And what kind of psychosocial support do they?
Okay, it looks like we are losing Harriet there, but I think she was just emphasizing the key programs that needs to
then intervene at those various levels. Because as we look at the child, it's really about multi-dimensional aspects that affect the child when it comes to child protection. So at that level, at that family level, we need to really understand in depth issues that are affecting the child and also affecting the family that is actually impacting the child. And then we can begin to think about what we can do at that level. So I think the song that we're singing here is the partnership. So when it comes to areas in which we are talking about the economic situation of the family that could be impacting the child and also the well-being of the child, what is it that we can do with partners that are actually helping with the livelihood of the family, so that at the end of the day we are able to bridge that gap that is affecting the family. Then when it comes to the church as a partner, very influential, very, very key in the
Okay, it looks like Harriet is having some network problems, but I think the gist of Harriet
setting, the family is solid, the family is actually functional, and the family is actually impacting the child positively. So even as we are looking also at the laws, the accountability, we are also looking at that still affecting the family, because when it comes to certain policies that are not in place, for instance, when we're talking about issues of child marriage and where there are some inconsistencies in some of the laws, where we are saying no, there's customary marriage law, there's also the legal law. So what is it that we are saying that the laws, the policies can do or can be done to ensure that the family does not have a leeway to actually marry their child off? So there are certain things that need to be in place at all levels that still impact the family. So it cannot just be at the family level, but at all levels in the society, in the community, around the child, that need really to be changed, to be looked at, to be adjusted. Thank you so much.
Okay, thank you so much, Harriet. At this moment, I would like to thank all my presenters for the day. You've all been so great. You did a good job. We truly enjoyed the presentations. I do believe even the participants really truly enjoyed the presentations and they had a lot to learn today. And I want to also thank all the participants for joining. It's so wonderful to see that we've had a stable participation from beginning to end. We thank everyone for joining from wherever you are, and please do join again in the next webinar that we will call not in the distant future. Very soon we shall be calling another one. We hope it's been a great time of learning. So thank you so much, everybody, for participating in the call today. Have a great day.
Thank you.
Thank you.
Bye-bye.
Bye-bye.